class. Welcome to week 2 of motivational interviewing. This week we're going to talk about the trans-theoretical model and the stages of change. And again, I'm Dr. Leadham from the program, the counseling program, the clinical mental health counseling program here at the University of Bridgeport. And I'm very happy to be working with you to help you understand the usefulness of motivational interviewing and maybe get started using it yourself, depending on your work situation. So this week, we're discussing the trans-theoretical model and the stages of change. So we're going to go over ideas about change, the process of change, how to tell where someone is in the process of change. We're going to look at our assumptions about people. And then lastly, we're going to try to put that together and help you understand why the stages of change goes hand in hand with motivational interviewing. In this talk, I invite you to explore how you change. What makes it difficult for you to change? And you will also name the stages of change. You will diagnose the stages of change from client descriptions. You will internalize helpful assumptions about other people and yourself, and maybe get rid of the unhelpful assumptions that we all carry around. You will begin to appreciate the whys of motivational interviewing. So here I'm going to present some ideas about change. So last week, you took a look at the resources on motivational interviewing, and maybe you got some ideas about why people seek counseling. People are looking to change their behavior, but they may not explicitly say that. And they know at some level that things need to be different. Some people just want to talk. That's okay, but increasingly insurance and grants pay for change and not talk. And so we have to know how to apply the science of behavior change to our work. Behavior change is very difficult. So think about how life would be different if changing and maintaining healthy behavior was easy. We wouldn't need medication, we'd have less need for counseling. And change is difficult, but the science shows us why change is difficult and what the source of the difficulties are. So the first question we want to ask is if knowledge of healthy behavior is the main reason why most people don't have maybe a healthier lifestyle or automatically take vaccinations, and etc. Maybe to some degree it could be knowledge, but I think if you think about it, for most people, they know what they need to do. Research has convincingly demonstrated the benefits of physical activity and healthy lifestyles for people, and most Americans accept this fact. But people are still unable to adhere to a healthy lifestyle program. Why is it so hard? And so I wonder how many of you get the recommended amount of exercise, and maybe here you are, public health students, and maybe you don't even know what your CDC recommends for you to get in terms of diet and exercise. So I guess that would be a knowledge problem. So 97% of Americans see a need to improve exercise in their lives. 70% of new and returning exercisers are at risk for dropping out. So there seems to be a cycle. where people contemplate exercise, they realize their need for change, they consider fitness courses, they enroll in fitness courses, they participate, the course ends, they stop exercising, and then they find excuses for not continuing, and the cycle goes on. Convincing research is not enough to cause change in people. Behavioral science has shown that most behaviors are learned from the environment and maintained by reinforcement. So the reinforcement comes from home, community, country, culture, family, friends and peers, school and the workplaces, television, radio and movies, and also biological factors make people more or less sensitive to different kinds of reinforcement. So our key terms here are behavior modification, which is the process of permanently changing negative behaviors to positive behaviors that will lead to better health and well-being. Reinforcement increases behavior, punishment decreases behavior. And so my question for you is, which is more powerful, reinforcement or punishment? And I hope you answered reinforcement there, because reinforcement is far more powerful in inducing and changing behavior than is punishment. But we all live in a toxic fitness environment, a toxic fitness and wellness environment where physical inactivity is predominant due to reinforcement. Learned behaviors have been reinforced and modified. Children watch adults and learn about rewards, and then those rewards become habits. So what are the kinds of habits that people have that decrease their health? Instead of walking, we drive to our neighbor's house down the street. We use elevators and remote controls rather than getting up or walking down the stairs. We order supersized fast foods. We use our recreational time to sit around watching TV or surfing the internet. And some people smoke, drink, and abuse other drugs and engage in risky behaviors. That's our toxic environment. And what makes it toxic? All those things are rewarding. And so unfortunately, whereas our rewards are supposed to set us up to pursue activities that keep us alive and reproducing, rewards, the way our brains program to use rewards is not really kept up to date for our current environment, and our environment has become toxic. So basically the availability of food is too much, and the need for exercise is too little. So some examples for this are the food portions at restaurants. So if you're looking at this meal here, that meal probably supplies enough calories for 3 people, or maybe even more, enough calories for 4 people. And the coloring, the smells, and everything cause people to eat more than their body really needs. So this is 4 times the amount of calories a person really needs, probably in one setting, at least. So notice everyone uses the escalators, no one uses the stairs. And also, so around our neighborhoods, in some places, there aren't places to walk, exercise trails are sparse, sidewalks don't exist or are in disrepair, maybe they're dangerous. So once formed, all these habits of eating too much and not exercising are hard to change. Most people do not start out life with poor health and unhealthy behavior. Problem behaviors are learned, and healthy behaviors are not learned. And then the time comes around middle age when people want to change but find this difficult to accomplish. By then, for many, low mental health, high blood pressure, type 2 diabetes, arthritis, and so forth have set in. And then the barriers to change become procrastination, cultural beliefs, gratification, risk, complacency, coping styles, complexity of our lives, indifference and helplessness, rationalization, illusions of invincibility, and anxiety and depression can all play roles for various people.